Right. So today we have a very special guest, and you just got to see a glimpse of her on the screen because it was on her first before it went to me. So, hi everyone, I'm Mr. Zimmerman, and I'm supposed to be the subject of attention right now. So we are going to interview, like I said, a very special guest, and the reason why is because today we're interviewing my sister. What? And I'm not just interviewing my sister because like she's a great sister. I'm interviewing her because she does something really important within the science field, and that is being a speech language pathologist. So she studied speech and language sciences, and she uses that to better help children. So let's give it up for Miss Lauren Zimmerman.
Thank you, Mr. Zimmerman, for having me. I'm really excited to talk with you guys about what I do.
Yeah. So right now, you work in a clinic. What clinic do you work at?
So I work at a clinic where we see kids with special needs. So working with lots of kids, it's really fun. We have lots of different doctors that we have there. So we really get to make a difference for people.
Awesome. And what do you do specifically as a speech language pathologist?
So basically, I mean, you think about the things you do on a typical day, which typically includes talking to other people, things like eating. So things that we take for granted, a speech pathologist really helps working on those skills. So I see kids that come in with special needs, so all different kinds of needs, and that have difficulty with communicating, difficulty with making the sounds that produce speech, or with telling someone what they want, being able to express themselves, or even something as simple as chewing, swallowing, things that we might take for granted, things that we do really naturally, but for some kids it really is a challenge. And so as a speech therapist, I get to work with these kids. Oftentimes I see them every week. We work a lot with the families, and we really just help them to build these skills so that they can be more successful with communicating and more successful with eating, with meal times, with all these different skills that they need to do.
Awesome. And a lot of it is processing how they speak over how they understand language, right? Most of them are able to understand the languages that they hear. It's just being able to do it themselves is very difficult.
So we actually do work quite a bit. So with language, we work on both receptive language, which is basically how you understand, like you were saying, so how you comprehend things that are being said. We even work with kids who maybe have hearing loss, so they wear hearing aids, which are these little devices that go in their ears to help them hear. Sometimes even kids with cochlear implants, which is something that they put in surgically, and that helps kids to be able to hear. So depending on what the kid needs, but we do work a lot on processing, on understanding, on listening, and we also work on expressive language, which is then how you get those sounds to come out into something that's meaningful. So we actually work on both a lot of the time because both go together. Some kids don't need to work on both. Some kids, it might be that they understand everything really well, but they have a really hard time actually getting the words out. And for other kids, maybe it might even be that they have a really hard time making the sounds that go into those words. So maybe they know what they want to say, but they just can't get it out. So it really does depend. Every kid is really special and unique. So it depends on what we have to work on. But so there's a lot to tackle with speech and language, and it kind of, a lot goes together. A lot of times we understand more than what we might be able to say for these kids. So it's possible that a kid might understand a lot but have a really hard time getting it out. So we work on all those things.
Yeah, sounds like a lot to think about. What kinds of disorders would you normally see? Like what kinds of like specific disorders? You gave us a good general idea, but what are some specifics?
So, I mean, we see a really big variety. That's what I really love about being a speech language pathologist, is that we get to see all different kinds of kids, and every kid is unique and special. So it really makes our job really interesting and really exciting every day. But some of the things that I really enjoy working with, I see kids who have hearing loss, like I talked about, or some kids have cleft palate or cleft lip. So basically what that is like where like the roof of your mouth, so up high up there can be like a little hole. And so sometimes what happens is when you have that hole there, when you're talking, the air actually goes up through the nose. So it almost sounds like you have a cold when you're talking. So we can actually help work on the difficulties related to that, trying to make the speech so that it sounds more, really sounds less like, you know, they have a cold and coming out of the mouth where it should be coming out. So we can work on that. We see kids with brain injury or possibly aphasia, which is basically a difficulty with language due to a brain injury. And that can be there's a lot of variety that goes into that depending on where the brain injury is. We see kids with feeding difficulties, which is something I really love working in that area. So that can be a really wide variety. For some kids, food is just something that is, there's just a lot that goes into it. There's a lot of like sensory information that goes into feeding. So for some kids, eating is a challenge, or maybe it's a little scary. It's something that they're not comfortable with, because kids eat all different ways. Some kids use feeding tubes to eat because maybe they're not able to swallow and chew. So when we're working with kids with feeding difficulties, we work a lot on you know, getting comfortable with food, playing with food, just learning about it, making it feel more safe for them, or working on actually chewing and swallowing. So there's really a lot of variety in what we see. So it's a lot of fun. It's a really rewarding job.
Yeah, that is a lot of variety. There's a lot that you have to probably have studied and known, and that you have to probably juggle a lot in your like normal day. So what is a typical day in the clinic like?
Typical day is very busy, but it's never boring. I love my job. I love the variety, like I said. I mean, a typical day is lots and lots of kids coming in. We work a lot with the families. So we typically have the parents come with us because, you know, parents are such an important part of our team. And we like to play games. Games are really fun. So we try to make the things we're working on, incorporate them into games or things that are motivating for our kids. And we just really practice, because practice makes perfect. The more you practice, the better. So we have kids who come in, maybe they're working on a particular sound that they have difficulty with, and we're going to just keep practicing that sound. Lots of practice, lots of activity. We do like to give homework, just like teachers do. Mr. Z would love that. So we try to encourage the homework aspect, because the more you practice at home, the better. So I mean, a typical day, we're running around, we're doing lots of activities, and really just trying to get kids to use their skills as much as they can, not only in the clinic but also at home, because it's really important that they get that carryover, which means basically that they practice their skills everywhere so that they can really learn it and be successful with it.
And what age do you start seeing your patients?
Yeah, so we see kids basically from birth to 21. So we see really little babies come in, and you can work on speech really early. If you think about little babies, how they communicate with lots of different sounds, even if they're not actually talking yet, we can start early, because early on babies are babbling, so doing things like they're, you know, ba 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 ba, pa, 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 pa. So there's early sounds that we want to be listening for, and if we don't hear those, then we might really want to start early to make sure that we get these kids the help that they need as quick as we can. So yeah, we see all different ages, but there are speech therapists who work with adults. There are speech therapists who work with, you know, across the lifespan. So it really depends on what each person, you know, what skills and what ages they want to work with. That's the fun part too, is we can see all kinds of ages and all kinds of people. So it's really fun.
How long does the average patient tend to stay with you?
It depends. You know, like I said, practice makes perfect. So the more practice, the better. And we are working on very kind of critical skills that take a long time to develop. Again, they're things that maybe we take for granted, things that we think we do naturally without thinking about, but there's so much that goes into just even making a speech sound and then putting those sounds together to make words, or in the feeding aspect of, chewing and swallowing, thinking about all the times you have to chew, all the times you work that to get it where it needs to go. So um, it really depends. Some kids are working on these things for quite a while, but as long as they're working hard and doing better, then we continue to work on those things. So some kids you can see sometimes for months, sometimes for years, but you're always adding new goals. So we're always thinking about the next step. So maybe we master one goal, but there's always something new that we need to work on, kind of like when you're in school and you're, going from one grade to the next grade. Um, there's always something new to keep adding. So, and then eventually we do hopefully get to graduate from speech therapy. And then, that's really an exciting moment too when that happens.
Yeah. So you specifically work in the clinic with children, but the speech language pathologist can do quite a few different things. They can work with older people or younger people. They can work in schools. They can work in clinics. So how does your job tend to differ from other speech language pathologists?
So yeah, I mean, there's a lot of different places where you can work. I work in the more medical aspect, so we really get to connect with a lot of different doctors, a lot of different people, professionals that really can help these families. And I really like that because, for example, I work a lot with hearing loss, and I really enjoy working with that. And so it's nice when I'm working with someone with hearing loss. If maybe their hearing aid battery dies or something happens, I can go and find the audiologist, which is a doctor for ears. Basically, they work with people with hearing loss as well. And the way that my medical setting is set up, I can just go right over and find them and they can come help me. So teamwork is really important in this job and in a lot of jobs out there. And so being able to get that help is really great. But wherever you work, you can find that. Even like if as a speech therapist, you can also work in a school setting, like Mr. Zimmerman was saying. And it's really cool because then you can work with the teachers and you can work with the psychologists there and you can work with all these different people there as well. So I think it kind of your system that you get to work with will change depending on what place you work, but it's really nice to have that teamwork. I think that's really important wherever you
Yeah. So, I mean, one side you're working with doctors and
go. Hmm.
audiologists, and one side you're working with teachers and school administration. So, sounds like both sides of the job have very important
Hmm.
teamwork and collaboration. And I really like that you said that because I think that science in general is so about that teamwork and collaboration. So it's so cool to see jobs that and how they stack up and how you can go to an audiologist for help or a teacher for help or
Hmm.
admin or we would go to the speech pathologist or the speech therapist for help to understand how we can better assist our children, students, elderly, uh, whatever in between. So
Definitely.
yeah, so you like you specifically worked in the clinic. What inspired you to do that specifically?
Hmm. That's a good question. So when I was younger, I actually did a lot of volunteer work in the community, and I learned pretty early on that I really wanted to help people with special needs because I got really involved with that, and I just saw how important communication is to people, how it really connects people, and that really inspired me to want to work more on that. I also really love science. But I also like the heart and the passion that comes with being a speech pathologist because you really get to use both. So you use those scientific skills to figure out how to help a child or whoever you're working with, but you also really get to put that passion in. So I think I really got inspired just from finding that passion in the community where I was doing my volunteer work, and I wanted to find a way to keep doing that, to keep doing something that I feel makes a difference.
Yeah, I remember growing up, you would go and read to all the special needs kids, and you were like, you would come home so like fulfilled by it. So it's so cool that you found a job that does specifically fulfill that passion of yours. Um, what are some specific challenges that you face in your field, and how do you overcome them?
Mhm. Well, I mean, probably the biggest challenge is just that, every child that you see is different and unique, and special. And so, kind of like a puzzle, you're just trying to figure out what pieces you need to help them be the most successful. So I think it's a challenge, but it's also really rewarding. It's really, fun and meaningful, when you do kind of figure out what's going to work best for a family and really help get the results that you're looking for. So I think that's, it's an important thing that we do, and it's something that we're always thinking about. You're always using those skills to try to figure out what's going to help, what's going to make that difference. And I think just how I kind of work on that is just always being creative, thinking about things that are going to be fun for that child and family, but also are going to help lead to the goals, lead to them mastering those goals. So kind of putting those things together and thinking about how can we use this activity to work on what we're trying to get done. So kind of linking those things. So I think, that's something that you're always trying to think about what's going to work best and how that goes.
Yeah, every child is different, and so you have to,
Which is great. Yeah.
yeah, you have to play that game and figure out what
Mhm.
goes for what child, and you have
Right.
to do that
We
as
do.
well. Uh,
Yeah. Very
so,
exciting.
yeah, for sure. All right, so if someone were going into the field, whether it's being a speech language pathologist or just studying speech and hearing sciences, uh, what advice would you give to them?
Well, I mean, definitely, I would say, study hard, work hard. Obviously, the things that you always hear, work hard, do your best. But I think in terms of like science in general and speech and hearing sciences, that, you know, there's so much critical thinking and so much important skills that go into it. So, really practicing, working hard on those skills, but then also putting that passion in, like I was saying earlier. So in school, when I was going to school for speech and hearing sciences, they kind of refer to it as a blend of science and the heart. And I think that that is really good advice because there are challenges with science, there's challenges with all the things that you face in that field. But it comes with a lot of really good rewards. And when you put your heart and mind to working on those challenges and overcoming them and remember that what you do does make a difference. I think that's really important advice because there's days where there are challenges where maybe it feels like you can't overcome that obstacle, but then thinking about, what inspires you to do the things you do and the mission behind what you're doing, and the heart behind what you're doing, I think it really helps you get through those things and find that you really can succeed and make that difference.
Awesome. Yeah. Being your brother, I know how passionate you are about what you do, and I know how much work you put into it. So thank you so much for all that you do. It's incredible, and it's very inspiring to me. I mean, what you do uh, pretty much inspired me in what I do. So thank you for that.
Thank you.
Um, what I really love about speech and hearing sciences is that you are kind of bringing, I mean, you kind of said it a little bit earlier. You're bringing together science and art and science and like language. You had to study linguistics as well. Yeah, so it's kind of cool because this is kind of the marriage between science, humanities, art, and you have all of that encompassed into one job. So I think that's so cool.
Yeah.
Thank you so much for sharing.
Thank you. Thanks for having me.
Yeah. All right. So we are finished with our questions. So, so thank you again. I will catch up with you later. Uh, and thank you everyone at home for watching. And hopefully you learned something really awesome about speech and language or being a speech and language pathologist. So, all right. We'll see you later. Bye.
Bye.